What is SIDS? SIDS stands for Sudden Infant Death Syndrome, and it's the sudden, unexplained death of an otherwise healthy baby, usually during sleep. It typically occurs in infants under 1 year old, with the highest risk between 2 to 4 months. SIDS is heartbreaking because it happens without warning and is not associated with any visible suffering or obvious signs of distress. It's commonly known as crib death or cot death. About 2,500 babies die every year from SIDS. What causes SIDS? The exact cause of SIDS is still unknown, but researchers believe it might be linked to problems in the baby's brain that control breathing, heart rate, and the ability to wake up during sleep. Some babies may have underdeveloped brain functions that prevent them from waking up if their breathing becomes restricted during sleep. Risk factors for SIDS. While SIDS can be difficult to predict, certain factors increase the risk. Babies who sleep on their stomachs or sides are at higher risk. Soft bedding, loose blankets, pillows, or stuffed toys can increase the risk. Babies born prematurely or with low birth weight may have weaker development of vital systems. Babies who are too warm during sleep are at greater risk. Smoking during pregnancy or exposing the baby to secondhand smoke can elevate the risk of SIDS. If there's a family history of SIDS, the risk can be slightly higher. Preventive methods. How to reduce the risk of SIDS. Now that we know the risks, let's talk about what you can do to protect your baby and reduce the chances of SIDS. Here are the most effective preventive measures. Always place your baby on their back to sleep. This is the #1 recommendation. Whether it's nap time or bedtime, always put your baby to sleep on their back. Sleeping on the stomach or side can block the airways. Use a firm mattress with a fitted sheet. Keep the crib free of loose blankets, pillows, stuffed toys, and bumpers. If you're worried about your baby being cold, dress them in sleep clothing instead of using blankets. Have your baby sleep in the same room with you, but on a separate surface like a crib or bassinet. Bed sharing increases the risk of accidental suffocation. Avoid overheating your baby with heavy clothes or blankets. A cool, comfortable room temperature is safest for sleep. Breastfeeding has been shown to lower the risk of SIDS. Try to breastfeed your baby, even for a short time, as it can provide protective benefits. Offering a pacifier during naps and nighttime sleep may help reduce the risk of SIDS. If breastfeeding, introduce the pacifier once feeding is well established. Avoid smoking during pregnancy and keep your baby away from secondhand smoke. Smoke exposure is a significant risk factor for SIDS. Ensure your baby gets all the required immunizations and vaccinations. Remember, moms and dads, while SIDS is scary, there are many steps you can take to reduce the risk. By following these safe sleep practices, you're helping to protect your little one and giving them the safest environment to grow. If you found this information helpful, don't forget to subscribe, like, and share. Let's spread awareness about SIDS and keep our babies safe. See you next time.